Hi, this is Amitha Balachandra. Thank you so much for tuning in. Now, I'm going to get straight to the topic that we're going to talk about today. Essentially, an announcement is coming from the Delhi government. The Delhi Chief Minister today has said that not wearing masks in public in Delhi will lead to 2,000 rupees fine. The amount before that was 500 rupees, and that has been increased to 2,000 rupees to help control the surge of COVID 19 cases, according to the Chief Minister. Remember, this comes in the backdrop of the fact that Delhi's COVID cases have now crossed 5 lakh, and the capital also has recorded the highest number of deaths at 131. Let me also give you some more update. Basically, the Delhi High Court has now also slammed the Delhi government, asking why they waited for 18 days, why were they in slumber at all till now, and that it's already too late. Remember, the government 2 days ago had decreased the number of attendees in a wedding from 200 to 50, but the High Court basically asked what the government was doing for the last 18 days. I'm also going to put up some graphs to show you how the situation looks like in Delhi as far as COVID 19 cases go. Those graphs will come up on your screens in just a bit, but the chart basically, that is a chart there that's been put out by Mint, which says that out of all of the states, the one that you're looking at right now is the one on testing. But if I can ask the producer to go down a little bit, you'll see that Delhi, Kerala, and Odisha have seen the maximum number of deaths. That is the graph that you're looking at. Delhi, the red line, right on top is Delhi, which has seen the maximum number of COVID 19 death cases. And as far as testing goes, in Delhi, like Kerala, they've also been leading in terms of testing. So, the scope of the conversation today is going to be this. Basically, whether steep fines are the answer now to try and control COVID, as the government is pointing at. Is that a strong deterrent at all? How important is it for us to wear our mask? Because that is the thing that we keep hearing. And also, how dire is the situation? Because a couple of days ago, we heard the government say that perhaps the fact is that COVID 19 has peaked in Delhi. Is that the case at all? And we have Dr. Sunil Sekhri, who is the Associate Consultant of Internal Medicine at Max Hospital, Gurgaon, join us right now. Dr. Sekhri, thank you so much for making time and speaking
Yeah,
to us. For viewers who are watching, please ask your questions in the chat window. The chat window is open. We'll take up those questions during the course of the conversation. Dr. Sekhri, first of all, I want your comments on the fact that the fine has now been increased from 500 to 2,000 rupees. Is that a strong deterrent?
yeah, that's a strong deterrent, and I think this is now a very important step at the right time because we were seeing that people are become a little bit relaxed. Now you go in the market, you go in the malls, you see the most of the people are not wearing masks. Those who are wearing masks, they are wearing it in a very improper way. So most of the time, the nose is exposed. So people have to understand that this, since virus is a respiratory borne infection, wearing of the mask is the only vaccine that we have right now. And increasing the fine from 500 to 2000 is a perfect step because this I think will be a great deterrent, and hopefully this will also help in decreasing the rate of spread of this COVID virus.
But is the government going to be able to sustain it? And the reason I ask you this is because case in point being Bengaluru, because we saw Bengaluru a month ago increase the fine to about 1,000 rupees, but that was brought down to 250 after public outrage. There's considerable public outrage over steep fines. So isn't it going to be a challenge to sustain that in Delhi?
See, one thing we have to understand is these fines are basically a deterrent in a legal way. We all have to be more of a responsible citizen. The population of Delhi is huge. I think somewhere around maybe more than a crore of people. So we cannot have policemen and law people everywhere. So it is a duty of a citizen to wear the mask properly. Don't do it for the sake of avoiding the penalty. Basically, two things. One, you are protecting yourself by wearing a mask. Secondly, in case you are an asymptomatic carrier, you are protecting the other people. So it's a social responsibility also. Do not look at the amount of fine. I mean, there will be public outcry. People will say that it is too much of money. But then why there should not be an outcry over it? Wear a mask. You don't have to pay a fine. You pay a fine only if you don't wear a mask. So the solution is very simple. Be a responsible citizen and wear a mask. So if you're wearing a mask, you're not even giving a single rupee of penalty.
Hmm. No,
So
but
it is
will the
basic.
government, but will
Yeah.
the government be able to sustain this? Because in other state like Karnataka, we have seen that the government couldn't sustain it, and within days of implementing that, they cut back the fine. Dr. Sekhri?
Yeah. So I understand. See, it is as I said, to maintain this kind of penalties is of course a big challenge, which we have seen in other cases also. But the important thing, as I said, is no, it is almost impossible for government anywhere, especially in a country like India with such a huge population, to regulate and the population. But the important, again, as I said, the important thing about this increase in the penalty is to make the people aware. Right, as we said, as I saw, there was in the past when the traffic violation, the penalty was increased, people were more observant. I mean, they were following the traffic rules much more than they were following earlier. So basically, again, this increase in the price, of course, from the government point of view, it will be difficult to implement, but it is a great deterrent, no doubt about that.
It is a great deterrent, you're saying. Implementing is a challenge, but could it
Yeah.
also be misused? Because one of the things that Aditya Hazarika has said, for instance, here in the chat window, is that there needs to be some sense in this. Drivers driving alone are also being stopped for not wearing masks in the car. I also want to ask you, what is the situation like in Delhi? We'll put up those graphs again, but you'll see that the number of deaths in Delhi have actually gone up. Is that a worry right now? Because Delhi is also testing far higher when compared to other states.
Yeah, see, basically this is a season of all kind of respiratory infections. And what death rate we are seeing, especially in our hospital and with my other colleagues, we are seeing people who are falling prey to this disease mostly have some other diseases also, right? And anyway, in winters we have a lot of other causes of death, but unfortunately in present time, if there is any death and the patient is COVID positive, we relate it, we say that it is because of COVID-19. Many a time the cause of the death is the underlying disease, like somebody is a cardiac patient, right? Somebody who's asthmatic and they fall prey to COVID-19. Now they get admitted, and suppose unfortunately there's a death in such cases, the cause of death is written COVID. Although the cause of death, COVID is just an exacerbating factor here. So that could be one of the factor in the statistics. Secondly, the season itself, this season is of respiratory infection, and maybe because we see our understanding of this disease is also very short duration. So this is the first winter that we are experiencing with COVID-19. Maybe the virus is more, maybe it's causing increase in mortality during this season. So slowly the data will come, and then we'll be able to understand it better.
I also want to comment on what the health minister Satyendra Jain said a couple of days ago. He basically said that you don't need another lockdown, but wearing a mask is more than enough. My question is, has COVID-19 really peaked? Because that is what the government is suggesting in Delhi.
Can you come again? I mean, I couldn't understand what you're saying.
The health minister Satyendra Jain has basically said that there is no further lockdown required and that COVID-19 has peaked in Delhi. Is that the case?
Yeah, see, as far as lockdown is concerned, the purpose of lockdown, as far as I understand, during the initial stages was to make the government machinery and the health infrastructure more solid. So we were not prepared at that time. And second, we have to understand lockdown is not the solution. See, virus is not like a vehicle or a human being that you put some barricade and it will stop. Right? It's a community spread now. It is almost everywhere. So lockdown essentially has no role in slowing the spread of the disease. I say it repeatedly again and again to my patients also and in my talks also that the only vaccine, the only preventive measure, the only lockdown right now we have is a proper wearing of a mask. Wear the mask 100% of time. 99.9% will not work. So be a responsible citizen. This is a very some people say ki, it is very uncomfortable to wear a mask. So I just give them an example. See, I step out at 8:30 from my home and reach at 8 o'clock back. So, and I'm always with a mask. And maybe that is the reason we doctors or other healthcare professional personals are relatively protected. We see COVID patient every day. We check them, we examine them, we treat them, and what we are wearing? Only a mask. So it's my request also, it is my suggestion also to all the public, wear a mask 100% of the time. And that is the vaccine we have right now. And it is damn cheap.
In fact, Anish has written in saying, what about enforcement? That's something that also is important, especially when you have steep fines like this. Another question from Shell is any other measures to help prevent COVID right now? So basically, you're saying while there are precautions that need to be taken, wearing masks is the most important thing for people to do. You can also help us explain, and I want to end the conversation with this question. If you can help us explain what kind of masks we should be wearing, and also how important it is for people to wear masks and at what times.
So important thing is as soon as you step out from your home or from your office, you should be wearing a mask, of course, in the office also. What kind of mask? For the public, the best mask is a 3-ply surgical mask. That is a very good, very effective. N95 masks are only for the healthcare professionals. Of course, the public can wear it, especially if they are going into a very crowded places, because they are really very effective. Cloth mask has been advocated and has been promoted by the government also and some health agencies also, because India is a very huge country, and initially we were not having enough supplies of surgical masks, but presently the supplies are very nice. We are even, I think, exporting these masks. So my advice is to wear a 3-ply surgical mask all the time. It should be properly fitted. Now another thing I see is the masks are loose from the sides, even from the nose, and then the air can go inside from there. That is the point of entry of the viruses. So essential thing is the mask should be properly fitted. It should be closed from all the side. Secondly, don't touch your mask with your hands if you're outside. You have to touch it, you have to adjust it, sanitize your hands. So that is another thing that will help you to be protected from the
But,
this COVID-19.
and a quick one-off question from Aditya, who's asking how often should the reusable mask be sanitized? He also asked, the steps you mentioned that you shouldn't keep touching it, right? So, what are the
Yeah.
steps to maintain hygiene, and also when do you sanitize?
Number one, the masks are not supposed to be sanitized. These are all single-use masks. So wear in the morning when you go back. Now, the important thing is dispose them properly. Fold them and throw them in a plastic lined dustbin. No sanitization of the mask is recommended, right? And as far as touching the mask is, suppose you have touched various surfaces and then you touch your mask to adjust it. So if your hands are contaminated, you have contaminated the mask now. Now that is the one thing. So if you have to touch your mask, sanitize the hands and then touch the mask.
All right, Dr. Sekhri, thank you so much for making and speaking to us. Basically, saying that wearing masks is mandatory. That's what we should be looking at right now. Of course, the Delhi government has increased the fine to 2,000 rupees, but we'll have to see what kind of enforcement really takes place and what is public's view of this as well. Because in Bangalore, we've seen that the fine was actually cut back, but for now, you're saying that this is what is important and it's a strong deterrent. Thank you so much for talking to us and for the viewers who are watching. Thank you.